Hello guys, today we are just going to talk about nitric oxide. Nitric oxide is a potent vasodilator and a chemical messenger in the body. Nitric oxide won the Nobel Prize in 2012. Dr. Luis Chignero and Dr. Farid Murad won the Nobel Prize for the discovery of nitric oxide. Nitric oxide has many health benefits. It helps in reversing diabetes, it helps in reversing heart problems, and when there is too much nitric oxide in the diet, it helps to open collateral arteries, and human can become heart attack proof. So nitric oxide is a miracle molecule for life, and even for the patients who are cardiac patients or who are cardiovascular patients and who have angina, and even with 100% heart blockage, nitric oxide is helpful in those patients also. Nitric oxide performs signaling actions in the body, so that nitric oxide can be called a signaling molecule as well. Nitric oxide is the most important part of our diet, and nitric oxide is present in green leafy vegetables, but it is present in raw form only. So if we can take green leafy vegetables in raw form without cooking, nitric oxide is present in them, but if we boil them or if we steam them, nitric oxide is just destroyed and then it is useless. The half-life period of nitric oxide is very short in the body, so we will just have to boost up nitric oxide levels in the body. L-arginine and L-citrulline is the precursors of nitric oxide. So if we want to boost nitric oxide in our body, we will have to add L-arginine and L-citrulline in our body. Except it, nitric oxide is also nitric oxide also gets boost with high energy exercises, and with there is an exercise which is called nitric oxide dump. So if we perform aerobic exercises, nitric oxide can be boosted up in our body, and nitric oxide is the most important molecule in. I just want to tell you another fact regarding nitric oxide, that if a person is going for too much mouthwash, then nitric oxide level is reduced in the body and there is more risk of getting diabetes. So the people who go for frequently mouthwash, they are at more risk for diabetes, because the nitric oxide level is very low in their body, because there are some useful oral microfloras present in the gut, and they are killed if the person is going for frequent mouthwash. So we will have to make sure that we are not doing mouthwash in excess. So according to me, mouthwash every another day or every alternate day is good, instead of going for mouthwash regularly. And mouthwash, if a person is doing natural mouthwash, like he is using natural sticks like neem sticks or some other materials or substances which are natural, that is better, instead of using chemicals in the mouth. So oral hygiene is good, but if you go for too much oral hygiene, and if you are too much conscious about oral hygiene, it can be a risk factor for diabetes as well.